And I'll just show you the bits of it in your chest that are abnormal. Let's see, long axial, this one here. So you're laying on the CT scan table, your head is up there, your feet are down here, and we're slicing through you, right, with slices. And I'm just scrolling through the slices and as we come down and into your chest. So this is the top of your lung on the left because you're on your back like that, right? So that's your top of the lung on the left, top of the lung on the right. And as we come down, and your spine is back here. And then now we're starting to see the aortic arch, and we're getting into your heart. And then we're just starting to see this little blob right there, and it gets bigger.
So is that in the pleural space?
Yeah, it's right up against the pleura, right?
Okay.
And so this is what remains is this thing.
So that's where all the fluid was in the pleura?
Well, this was a huge mess. I mean, this was all just a huge mess back in November of 23. Yeah, 23. November of 23. It was a huge mess. And this is what remains.
A Remembrance Day I will never forget.
This thing is what remains. And then it looks pretty good considering how it looked back then. And then there's maybe a lymph node here, but you had significant lymphadenopathy back then. They don't even mention it on the report this time, I don't think.
I had a friend that died a friend's wife that died about 3 months ago from that. What's the name of the disease again? The one it's the same one as the one that was up in Rath-Trevor, right?
Well, no, this isn't the same, but it's similar.
Yeah.
The Rath-Trevor one, the local fungal infection is Cryptococcus. Yours is coccidioidomycosis.
Okay.
Cocci. We call yours cocci, and we call the local one crypto. But they're both fungal infections. Yeah, I mean, I like this. They say the lobulated, somewhat nodular, persistent subpleural opacity described above could potentially be a residual complex loculated pleural collection or debris. Now, I think that's a reasonable explanation.
So I've got good heart vessels?
Oh, yeah, your heart and everything looks fine. A mild stranding. I'm just looking. They don't actually say that there's lymphadenopathy, because that's good, because you did have significant lymphadenopathy before. Peritoneal space. And then the rest of your scan, like if we just sort of keep going, where do we keep going? This way. If we just keep going, these are lung windows, so they're best to look at the lungs. And then we get down into your organs. And then for organs, we look at a different kind of image. In this one, maybe. And this is better for your organs, just to look at organs. And we get down.
Crazy.
And then there's your liver and your pancreas and your spleen and stomach. And, we don't see any masses. Everything looks fine. A little gallbladder here, your 2 kidneys. So they've given it a good once over, right down into your pelvis. So there's no masses, no lesions, no significant lymphadenopathy, nothing abnormal, nothing unusual. Okay, so I'm reassured by all that. It's a good screening test. It's not perfect, but you had a great screening test. And the only real thing left in your lung is, again, it's this.
How many is there?
Well, just this thing over here, right?
Oh, I see.
There's it's got some calcifications in it, as you can see there, because that on this
but nothing.
image,
It could be tumorish.
Oh no, it's.
What would it look like if it was a tumor?
Well, I mean, it usually it's more nodular and not so pleural based in the lung parenchyma. This one's kind of splotched out in the pleural space.
So how big would that be? That's like what?
Yeah, like
tumor?
that. Yeah.
Could that explain why it still hurts to breathe?
Yeah, it could. This could still be irritating somewhat over here on the.
It's only on deep. It's like shallow is fine.
Yeah.
It's only when I go.
Yeah.
Like right to the top of the lungs. Some mornings I still wake up and it's like, ugh. Like if I don't wake up and have if I wake up and have like an initial like fresh air and you're like, I'm like, oh, and I got to do like 5 or 6 exercises to. Is it possible to get one, or where do I get one of those breathing machines they gave me in the hospital that
Spirometer?
whatever that thing was?
You mean just the blue plastic, and you blow in a tube to make it? Yeah, I'm sure you could get one. I'm not. If you could, I would try maybe like a respiratory supply store, like the places that sell oxygen.
Okay.
They might sell those. You could probably buy it off like Amazon.
What's it called again?
A spirometer.
Spirometer.
So this thing here,
so good.
the thing with this is, like, whenever there's a big sort of residual inflammatory nodule like this, it's a big splotch of, maybe it's fluid and debris and scar tissue and stuff like that, right? That's left over. Whenever you see this, it's hard to know, is it sterilized, right? And I don't have a test that tells me, oh, are there any fungal things alive still in there? Well, there might be, but I hope not after all that fluconazole you took. And all your labs are great, right? Like, your labs are really good. Your lab tests, you got, what I did just now was completely normal. And then your inflammatory marker is 1.2, which is the best one ever. It was 27, 2, 6, 2, 1. Yeah. So, that was back in January. Like, you were 1 month or so, 3 weeks.
Into fluconazole.
Yeah, into fluconazole at that point. You did. Now, I bet in the hospital it was probably 100. Let's look and see what it was in the hospital. Because I would bet it would be, it's not loading. Just a sec, I need to just change the parameters.
November 11th is, I think I landed in Canada 22nd or something.
There we go. Yeah, because it would be impressive. It's going to be, yeah, there. Look, it was 156.
Holy crap.
Right? And then
that's after I'd already been under treatment for, was that one above 291?
Well, no, that was 23. That was before we started the fluconazole.
What was that above? 291, 418?
Yeah, 291. So that's November 30th. That's the day after your surgery, right?
Crazy.
And then 418, 280, 30. And then, a year later, it's 1.4. And, now it's 1.2. It's still super low. Like, we got it right down to normal, right? So, that's normal. And then the other thing that's really good is your serology, you've seroconverted to negative. Like, it's almost as if you've never had this infection, right? Like, your serological studies have turned negative.
And that's the stuff that went to the level 4 lab in Winnipeg?
That's right. And so I repeated it twice, because I did it just now in July, and I also did it back in January. And that's one of the reasons why I felt comfortable. Actually, it was February. I was happy to see that in February. It made me feel good that we'd stopped your fluconazole at that point. Because you had a year of treatment, right? You had, I think, 13 months or something like that.
Lots of it.
Yeah, because this is a funny organism, and if it infects someone's brain, and I have one case of that right now. In fact, I saw that woman this week in my office. And every time I see her, I think of you, and every time I see you, I think of her. But she has it in her brain. And she's someone, she used to go to Scottsdale, Arizona every winter, play tennis, hang out with her friends. She's a snowbird, a Canadian, who goes down there for 5 months every winter. And sure enough, she caught this down there, because there's a lot of this germ is in Arizona. And she got it down there, and she ended up, she got a chest infection, but then it spread to her brain. And if someone has it in their brain, you actually treat them with fluconazole forever.
Wow.
Yeah, but in the lung, we tend to not do that. And really, I have no evidence that you have any persistent infection. Like, things are totally stable. Like, your labs are perfect. Your serology is converted to negative. Your CT scan is stable. Every time we do it, it looks a little bit better. Your CT scan will probably never look normal, but you've got a residual scarred nodular thing there. And as long as that doesn't, blow up and spread, cause inflammation and stuff, it doesn't look inflammatory and active. And certainly your lab tests would indicate that it's not active or inflammatory. So that's not an issue. So I'm, confident that the coccidioidomycosis is not affecting you. So then if you're having symptoms, it's other stuff. So then we can talk about that. Like how exactly are you feeling these days and what's up?
Hard to breathe. I've had, I went for a road bike ride the other day, and it felt like I had never jogged in my life. Would it make sense that I have majorly reduced lung capacity?
Well, that doesn't. No, it shouldn't.
Or is it just because I've been too lazy for too long?
Well, you might be a bit out of shape, but we should.
Yeah, this is definitely a shape.
We could do PFTs or pulmonary function tests. We could do pulmonary function tests.
And what's that? That's just
well,
pushing
that's
my
just
heart?
it's testing your lungs to see what your lung compliance is and if there's
I've
any
done one of those
reactive
before.
airways. Yeah,
Put you on the treadmill
blow
and-
really hard. No, it's not a treadmill test. You blow into a machine as hard as you can. You breathe in and out through a tube, and it
I've done
measures
that one before
the
too.
volumes and the speed and volume of and velocity of air in and out of your lungs, and it tells us about volumes and velocities, and so that tells us quite a bit about lung function. They can also measure oxygen diffusion with that test. So that's one thing you should maybe have done. Now, you don't have a primary care, right?
Dr. Olivier.
Olivier.
Yeah.
Yeah, okay.
Johan.
Johan?
Like
with a J?
Yep. Johan Olivier.
Okay. All right. Well, that's good. I didn't know you had a family doctor.
I guess over the last year, you've kind of been my family doctor.
Well, when did you get this doctor?
15 years ago.
Oh, okay.
Yeah.
Oh, I
Yeah,
didn't realize you had.
Yeah, he was getting all the requisitions, every single, he gets copies of everything.
Oh, okay. Well, I didn't send him a copy of my letters, so I'll send him a copy today.
Sweet.
Yeah. So, and I'll maybe make some recommendations about